confidence and other negative beliefs, and also mood. Okay, but it's good to know that many of these factors can be changed with appropriate guidance and support. Alrighty, so some non-modifiable risk factors. Okay, so we've got age. So osteoarthritis becomes more frequent with increasing age. OA is irreversible, but the symptoms can be reduced and even disappear, which is very good to know. And pain is more dependent on muscle strength than on X-ray changes. Okay, so it's important not to focus too much on the X-ray findings. Now, in terms of gender, osteoarthritis is more common in women, with women more commonly experiencing osteoarthritis in the hands and knee, whereas men more commonly experience OA in the hip. And in terms of heredity, so if one or both parents have OA, the risk of their child having it as an adult is increased. So we can, to some extent, modify this genetic risk by adopting a healthy lifestyle. Alrighty, so how is osteoarthritis diagnosed? So there are two ways of doing this, okay? So we've got an X-ray, and this will show reduced joint space, osteophytes, cyst formations, or increased density of the bone beneath the cartilage. Or what we can do is we can diagnose it based on symptoms, existing risk factors, and findings from a clinical examination. Now, it's common to experience symptoms for 10 to 15 years before osteoarthritis shows up on an X-ray. And the link between X-ray changes and symptoms is generally poor. So it's very important to note that it's always the patient's symptoms and not the X-ray changes that guide the choice of treatment. So that's a key point. Now, scans may be important in the case of a traumatic injury or if something other than osteoarthritis is thought to potentially be the cause of your pain and symptoms. In almost all cases, the diagnosis of OA can be made based on pain and symptoms you report, a clinical examination, and potential risk factors specific to you. X-rays are still needed to help make a final decision on whether to undergo joint replacement surgery, since those with only small to moderate structural changes are less likely to respond to surgery. All right, so let's just go over a little bit of the anatomy. So we've got on the ends of the bones, they're covered by that cartilage that we were speaking of, and they are also surrounded by an articular capsule. Okay, so as you can see on that little diagram on the slide there, and this capsule produces that synovial fluid, which lubricates and nourishes the cartilage. Okay, and you've also got ligaments and muscles, which help stabilize the joint and produce movement. Now, the cartilage has no blood supply, okay, and therefore it needs nourishment from this synovial fluid. Now, this synovial fluid needs to somehow move in and out of the cartilage, okay? So this can occur through dynamic loading, so cycles of loading and unloading the joint, for example, with walking or exercising. So cartilage is like a sponge, so think of it like a sponge. Pressure, so when you're walking or exercising, pushes the fluid out, but when the pressure is released, cartilage sucks fluid back in. So regular exercise ensures cartilage remains efficient at drawing fluid back in. So that's something really, really important to know there. Alrighty, now a little bit of anatomy about a healthy knee joint. So like we've already mentioned, we've got the cartilage on the ends of the bones. Now with the knee, we've got two menisci, which are two little shock absorbers on each side of the knee, and they're important for dispersing the forces. Okay, we've got the articular capsule, which produces the synovial fluid, and then we've got the ligaments and muscles to provide stability and movement. And it's not always clear which of these structures become sensitized and cause pain. It could be some or all of them. Now, the healthy hip joint, so pretty similar. The only real differences are that the hip joint doesn't have any menisci, okay, but it has all the other factors that we mentioned before, as well as a bit more range of movement. So your knee is a hinge joint, so it goes backwards and forwards very well, whereas your hip, you can go side to side a bit more as well. Alrighty, so what happens with osteoarthritis? So you get structural changes in the joint, and this may be due to a number of factors, including the cartilage being exposed to too much load all at once, so that would be your acute injury, too much load over a long time, so an overuse injury, too little load, so your tissues need a stimulus to regenerate and remain strong, and it can happen with a normal load if the cartilage is diseased to start with. So remember, your hip or knee pain can be made worse by many factors that you may not immediately think about. Okay, so things like poor sleep, diet, stress, and some poor beliefs as well. Alrighty, some signs of osteoarthritis. So osteoarthritis usually starts in one joint. Symptoms can develop slowly and may stop completely, but the experiences will vary from person to person. Stiffness, especially in the morning or after sitting down for a period of time. So it's usually short-lived, less than 30 minutes. And in the beginning, pain usually occurs only during weight bearing, but later on, the pain may also occur at rest and at night. And you also get inflammation, which can present as swelling, redness, and heat. Now, a little pointer about this. So steroid injections may help with this symptom, but it's usually pretty short-lived, so only lasting for about 1 to 4 weeks. And pain associated with OA is not from the articular cartilage. As we mentioned before, it has no blood or nerve supply. So basically it can come from the bone, ligaments, muscle, the joint capsule, or where the tendon joins the bone. And symptoms can be random and vary. Okay, so there is often no link of intense symptoms to activities. All right, so some common problems with hip and knee osteoarthritis. So as you can see there's a bit of a list. So osteoarthritis can create challenges to completing many activities. So I want you to have a think to yourself about which of these activities you have trouble with. And if there are any other activities not listed that you find challenging due to your osteoarthritis, feel free to share them now in the comments or during the GLAD sessions themselves. And you can work with your physios to develop realistic goals to improve your ability to do the things you want to do. So GLAD may help achieve many of these goals, but there may be other exercises or treatments which can be added to help you get there as well. All right, so let's talk a little bit about fatigue. So people may stop doing physical activities that they like due to feeling tired and lacking energy. Once they have done all the things that they must do, they're exhausted. Fatigue cannot be slept away. Okay, so fatigue is different than ordinary tiredness. Ordinary tiredness is the tiredness you feel when you haven't got enough sleep, and it usually goes away if you get a good night's sleep. So fatigue is common in inflammatory joint diseases and other lifelong illnesses. The cause of fatigue might be a combination of an ongoing disease process and long-standing pain and stiffness. And we know that poor physical and psychological status can increase fatigue. So what you can do to decrease fatigue includes being physically active and being in better physical shape. So start slowly and gradually build your activity levels. All right, so let's go through this osteoarthritis treatment pyramid. Okay, so treatment aims at reducing symptoms and improving joint function. Every person seeking care for joint pain should be offered, so what's on the bottom of this pyramid, so education, exercise, and weight reduction if necessary. And this recommendation is supported by Australia's national guidelines for osteoarthritis care. In the first line of treatment, if the first line of treatment doesn't lead to a satisfactory outcome, it can be complemented with pain medications, TENS machines, manual therapy, braces, shoe insoles, other aids, and in some instances, injections. So that's that little section in the orange there. However, these strategies cannot address the range of factors contributing to pain and disability. For example, the only way to improve your strength is to complete an exercise program. And for those with very severe symptoms, so about 10 to 15%, surgery may be considered. So a few different types of surgeries that you may have heard of include just a full joint replacement, where the joint surfaces are replaced with metal or plastic, an osteotomy, which we'll talk about later, as well as arthroscopic knee surgery. Okay. Now, studies have shown with this type of surgery that they have no better effect than a sham or placebo. So they did a study where people got an arthroscopic knee surgery, other people didn't, and they didn't find any differing results afterwards. And we'll go through that as well a bit later on. Alrighty, so it's essential to understand the possible causes of osteoarthritis, what can be done, and the importance of self-management since it is a lifelong disease. Okay, so exercise is effective for pain relief. Different types of exercise, like walking and strength training, are effective in relieving pain. Neuromuscular exercise is just as effective for pain relief, and in addition aims to improve stability and confidence of the affected joint. Dose of exercise matters, so more is better, but to an extent. And during neuromuscular exercise, you will practice doing things you do every day, like getting on and off the floor, rising from a chair, and walking, with good movement quality and loading the joint the best possible way. So this is what makes the program unique. Okay, so the activities are very applicable to your everyday life. Now, in terms of weight reduction, okay, so with normal walking, the knee joint is loaded with at least 2 to 3 times your body weight with each step. Being overweight increases the risk of the cartilage and joint becoming somewhat overloaded. Now, a relatively small reduction in weight has a large effect on joint load. For every kilo you lose, the load is reduced by at least 2 to 3 times, which is quite a large amount. So improved diet and exercise used to reduce weight is also likely to be beneficial to your pain due to improved general health as well. Now, in addition to just the excessive sort of load being placed on the joints, having excess fat or adipose tissue can enhance your systemic inflammation that you have in your body. And as osteoarthritis is an inflammatory condition, this can be enhanced. So that's another reason why weight reduction is one of the key things that we're looking to target. Alrighty, so the Australian Clinical Practice Guidelines, which are published by the Royal Australian College of General Practitioners, recommend that all Australians seeking care for osteoarthritis should be offered exercise, and GLAD provides a great option for this. All right, so let's have a bit of a chat about the second line treatments. Okay, so these second line treatments should not replace first line treatments. This is because they have varying levels of evidence to support their use. However, they are often associated with benefits in reducing pain in the short term. So they can be helpful as an adjunct to first line treatments. Some additional treatments guided by your physio. So we have shoe inserts, orthotics, taping and braces, which may help reduce pain and improve your confidence. However, alone, they are rarely a long-term solution. Dry needling or acupuncture and manual therapy can help reduce pain in the short term, but long-term, these treatments are unlikely to help. And using a cane or walking stick in the opposite hand when walking reduces the load on the aching joint, which may help prevent limping. Walking poles do not provide the same support as a cane, but they provide a larger support surface, and this can result in better balance. And hot and cold packs and electrical stimulators can also help reduce pain and are easy to use independently. So yeah, like I said, think of them as complementary to your first line treatment. So let's talk a bit about pain medications. So paracetamol, so you common things like Panadol, Osteo, they have few side effects and can help pain in the short term. However, studies have shown there are no long-term benefits to regular use in comparison to a placebo. Now, in terms of your non-steroidal anti-inflammatory drugs, such as Nurofen, these are estimated to be 3 times more effective for pain relief compared to paracetamol. However, they are associated with greater risk of side effects, including stomach ulcers, and are not recommended for people with other chronic illnesses like heart disease. So always consult your GP about what pain medications might be appropriate for you. So in terms of opioids, so there is no evidence opioids like OxyContin and Endone will help. In fact, they may make pain worse in the long term. Some research indicates that 1 in 550 people who regularly take opioids may die of an overdose, and guidelines around the world would recommend against taking opioids. And if you are taking them, you may wish to speak to your doctor about strategies to reduce your dependency. All right, so cortisone injections. So they can be helpful for short-term pain relief, but they have no benefit in the long term compared to a placebo injection. So occasional adverse events such as joint infections can occur. So it's important to note that because they don't often tell you that. And also repeated injections of cortisone over 2 years can lead to more rapid cartilage loss. All right, so we'll quickly go through some other common injections that you may have heard about. So we've got hyaluronic acid. So this is an artificial fluid proposed to replace joint fluid. There is limited evidence of short-term benefit, and risks include joint infection and worsening of your condition. Platelet-rich plasma, or PRP, is proposed to increase the concentration of growth factors in your joint. It uses your own blood, which is processed and then re-injected into your joint. And there is limited evidence that it helps pain for up to 12 months, but this is not conclusive. Alrighty, so in terms of surgery, so it should be reserved for only for people not responding to first and second line treatment. So it's the final stage and the final thing that we should turn to before trying out the first 2 stages. Alrighty, so let's have a bit of a chat about arthroscopic surgery. So it's a very common procedure, and it's associated with a reduction in pain, so usually about 30%. However, arthroscopic surgery is no more effective than a placebo or a fake surgery in multiple studies of people with knee pain. So fake surgery is also associated with around a 30% pain reduction, which is quite interesting. And this meaning that benefits are likely due to factors not related to the procedure. Okay, so this could be post-surgical rehab, better management of loads, reduced fear of exercise, or any number of other factors. So the age of patients in these studies is 35 years and older, so not just older people as well. And any surgical procedure has risks which must be considered. In the knee, guidelines all around the world recommend that arthroscopic surgery should not be performed for people with knee OA. And in the hip, there is much less guidance at this point in time. All right, so joint replacement surgery. So it's a good operation for the right person. It should not be provided to people who have not adequately trialled first-line treatments. So our education, our exercise, and our weight management were indicated. And most people with knee osteoarthritis will delay surgery following the completion of a program like GLAD. Okay, so 2 in 3 people will delay for at least 2 years, which is really promising. Now, although most people benefit from this large procedure, not all of them do. So as with all surgeries, there are risks and potential complications. And completing an exercise program first means you are better prepared for the surgery anyway. So, alrighty, so if you have osteoarthritis in only one part of the knee, the surgeon may suggest osteotomy. Okay, now this procedure takes a wedge-shaped part of the bone of the lower leg and places it in the knee to help redistribute the load. Another common surgical procedure is a partial knee replacement, okay, which typically involves replacing the joint surfaces on the inside of the joint. All right, so let's have a look at some of the results after GLAD participation. So as you can see there, people that have completed GLAD have found that they've had improved joint confidence, reduced pain, improved quality of life, the need to take less pain medications, less sick days, and they're less likely to feel the need for surgery. And also, I want you to continue to talk to your physios about your progress and definitely set goals, short-term and long-term. And there are a range of other treatment options available. So if you're not reaching all of your goals, there may be other treatments or exercise approaches you could add or try as well. All right, so I've just got a little slide here as well. So in the green is what is of high value. So your active treatments, the ones that you're doing yourself and guided by physios. And then of low value, so you got your passive treatments, so the ones that are done to you, like dry needling, massage, and TENS machines. Alrighty, so feel free, guys, to stand up, have a bit of a walk around. We'll have a 30-second break. I'm sure that's a bit of a lot to take in. I hope you're all enjoying so far. So we'll get back to it in about 30 seconds. Yeah. All good? Perfect. Alrighty, guys, we'll jump back into the next part of the education session. Okay, so this part, we're going to talk about exercise and self-management. Alright, so let's quickly review the osteoarthritis treatment pyramid. So treatment guidelines from all around the world, like we've said, are based on recent research and emphasize the importance of early treatment in the form of, we've got the education, which we're doing now, exercise and weight management if necessary. Now, other treatments may help, but they should complement and not replace first-line care. So just reiterating those messages. All right, so let's talk about exercise and physical activity. So physical activity is good for everyone, and staying active is an important part of managing osteoarthritis. Physical activity can occur during leisure activities, so when you're walking, playing sport, or through your occupation as well. However, you may not always have control over the load your body undergoes at work or during leisure activities. For example, carrying a box heavier than what your fitness level can handle may lead to discomfort. Another example might be trying to keep up with your friends in a walking group who walk faster than what you are capable of. So exercising to get stronger and improve your fitness level can help you deal better with what you need or want to do. Therapeutic exercise is carried out with a specific purpose and can be guided by a health professional. It can also improve your ability to be physically active in work and leisure time. Therapeutic exercise can be designed to work on many things to help people with osteoarthritis. Now, in terms of neuromuscular exercise, which is a major focus in GLAD, so this can improve the way you move and give you more confidence as well to do other exercise. In GLAD, exercises are also completed to improve muscle endurance and strength, along with your ability to perform common functions well. So like standing up from sitting and walking up and down stairs. Exercises can also be given to improve muscle power, so where your muscles generate force quickly. And this may help you improve your balance and ability to do activities requiring more muscle power. So walking a bit more quickly and running as well. So exercises to improve flexibility, like stretching, may improve your joint range of motion. And we go through a few of them during the GLAD program as well. And in terms of aerobic exercises, so if you're undertaking a walking program or using an exercise bike, so these may help improve your cardio fitness, which can assist you to get back to many recreational physical activities as well. And you can also turn your daily tasks into therapeutic exercise. Okay, so for example, walking to the shops instead of driving, and you may choose to walk faster, which requires your heart to beat faster and you feel a little short of breath. So this would be a nice form of aerobic exercise. And getting up from sitting can also be an exercise if performed with a focus on how the movement is performed. Okay, so thinking about, are my joints in the right alignment? Do I load my joints in the optimal way? Do I contract my abs and hips to help stabilize my body when standing up? So this is something you do purposely. And whether completing occupational, leisure physical activity or therapeutic exercise, you should exercise at a level that suits your fitness level to see improvement. Okay, so repeat the exercise, increase load gradually, and continue to challenge yourself. All right, so why do we need to be physically active? So exercise and physical activity is medicine. So being inactive increases our risk of at least 35 chronic diseases. Exercising and being active can help us prevent and treat many other chronic diseases and not just osteoarthritis. So these include cardiovascular and heart disease, diabetes, dementia, and certain cancers. There are many positive effects of being physically active, and some of these include lowering your blood pressure, improving the way your body handles blood lipids, cholesterol, and blood sugar levels. Better physical fitness will reduce how tired you feel after exercise, and your body will use less energy to do the same amount of work. Your body will improve connection and control to your muscles, so they will become better nourished and stronger as well. Bone density will increase, particularly important for those with osteopenia or osteoporosis, or just to help reduce the risk of developing them. And as explained in the previous session, cartilage requires dynamic load to regenerate. Alrighty, so your appetite and body energy metabolism is affected with exercise as well. Exercising might increase your muscle mass, okay, so since your muscles are growing, and as muscle weighs more than fat, you might actually see an increase in weight. However, having greater muscle mass is better than fat and is linked to other positive health effects. Exercise increases the endorphins released by the body, which results in less pain and better mood as well. Alrighty, so guidelines in Australia recommend at least 150 minutes of moderate, so where it feels slightly difficult, or 75 minutes of vigorous physical activity per week. A simple aim is to complete 30 minutes per day, for example, in bouts of at least 10 minutes. Exercise should be completed at an intensity where you start sweating and become slightly short of breath. This means that endorphins will be released and you will start the adaptation process to get stronger and fitter. To improve your physical fitness, you should exercise at roughly 60% of your max heart rate. So an easy way to calculate your max heart rate is to subtract your age from 220. For some people, 30 minutes a day seems a long way off. Okay, so it may be helpful to set a similar initial goal. For example, most people with severe NEOA can complete 10 minutes of moderate intensity walking per day, generally without increasing their pain. So doing something is always better than doing nothing. All right, so what can you do to stay active? So programs like GLAD can help you build your capacity to be active and achieve physical activity goals. And it's important to find activities that you like so that you can prioritize regular physical activity. So here are some examples of a wide variety of activities to consider. So we've got walking, which is a relatively simple activity. So start with small distances and gradually increase. Later, you may also like to increase speed. Running, which is something people often avoid with osteoarthritis. However, there is no evidence to suggest small amounts of running is harmful. Ensure you aim to build your capacity to run through targeted therapeutic exercise and gradually introduce it. Some people who have not run for many years get back to running after GLAD, but it can take many months. And other people completing GLAD already run regularly. Osteoarthritis does not necessarily mean you need to stop. Alrighty, so cycling. So it's a very effective in improving physical fitness and requires less joint load than walking. Cycling also requires a knee bend of approximately 110 degrees. So we need that range of motion. And you can adjust the saddle height of the bike so that the knee is kept at 10 degrees bend when most extended. So that's a nice way to set up how you use your bike. Now swimming and other water exercises like running in water or water aerobics can be a great form of physical activity and it places less load on hips, knees and feet. Dancing is also a great form of physical activity, and like all exercise, you should start slowly, especially if you have not done it in a while. And importantly, some forms of dancing can be quite challenging for people with osteoarthritis and also me. So talk to your physiotherapist about exercise strategies to build your capacity to dance. Now, aerobic exercise. So this can improve strength, stamina, and coordination, and ensure that you wear appropriate footwear when doing aerobic exercise. Be cautious of jumps and sudden changes in direction. And like all things, start slowly and gradually build up. Strength training. So it has many benefits. In fact, guidelines recommend two sessions of strength training per week, due to benefits for things like bone density, balance, and cardiovascular health. It should be guided and supervised in inexperienced people to ensure proper technique, and programs should be progressed every few weeks as you improve. So choosing to walk to the shops or work, brisk walking or taking the stairs is often all it takes to be more active. Okay, so everything is better than nothing. Alrighty, so just reiterating this. So the Australian Clinical Practice Guidelines, published by the Royal Australian College of General Practitioners, recommend that all Australians seeking care for OA be offered exercise, and GLAD provides a great option for this. All right, so why is it important? Why is exercise important? So cartilage needs to be appropriately loaded to regenerate itself. So like I said before, when loaded and unloaded, synovial fluid is pumped in and out of the cartilage. This stimulates new development of cartilage, which improves its shock absorbing capacity. Inactivity, excessive load from hard manual labour for many years, and some elite sports can cause an imbalance between the development and degradation of cartilage. Starting to exercise early will have a greater effect on the development of cartilage compared to if you start when you already have severe stages of OA. But it's also to note that it's never too late to start as well. You can always see an improvement. And the things you practice doing are the things you get good at. So by increasing range of motion in the joint and strength of surrounding muscles, it will become easier to perform everyday activities. So how should we be exercising? So having strong muscles helps stabilize the joints and improves your confidence to complete activities you need or want to complete. Using the right muscles at the right time with appropriate force makes it easier to control your movements and complete functional tasks. It's important to give your body time to recover and rebuild itself between exercise sessions as well. So rest is definitely a major component of the GLAD program as well. So, and this is why our 2 exercise classes will be spread out over the week. Alrighty, so the hip, knee and foot should be appropriately aligned when you exercise. Control, quality and concentration are required for neuromuscular exercise to load the joint more evenly. Ideally, the knee should not fall inward or outward when you sit down or stand up or complete other activities. However, this can depend on each person's structure and function. And a neuromuscular approach to exercise is effective at reducing pain and improving confidence in most people with osteoarthritis, even in people who are about to have a joint replacement. So how much should we be doing? So Like any treatment, exercise needs to be adequately dosed. Completing exercise less than 2 times per week is unlikely to be effective. 6 weeks should be the minimum period an exercise program is completed to give it a chance to work. And research shows that shorter programs will not help and do not allow long enough to improve strength. The best exercise is the exercise that gets done. And 10 minutes of walking a day can equate to 70 minutes a week, which then also equates to more than 60 hours a year. So at slow speed, this would be well over 200 kilometers in a year. So it all adds up. Alrighty, so it's important when starting a new exercise or exercise program not to do too much too soon. So this is important in programs like GLAD and also other exercise you may choose to do. The right amount of load will help you get stronger and improve the health of your cartilage. Each person needs to learn their correct amount of loading, and this load can also be trained up as you do more exercise. And after taking a break from exercise, your load would also have to be adjusted again. Alrighty, so it's vital to understand that pain does not equal damage, okay? So pain is a companion to OA. It often hurts when you start exercising, okay? And it's okay if it hurts when you exercise, but to a certain extent. Humans are hardwired to treat pain as a warning signal. However, with OA, this can prevent people from exercising. Alrighty, so firstly, pain during exercise must be perceived as acceptable. Okay, and secondly, any increase in pain during and or after exercising should subside within 24 hours. So they're 2 important things to note. And this same guidance has been used successfully by thousands of people with OA to help take control of pain when exercising. It has been shown repeatedly that the more exercise you do, the less pain you will have. And exercise is dose dependent, and in this case, more is better. Pain does not originate in the knee. Okay, so pain is created in our brains based on different factors, like we've mentioned before, including thoughts, feelings, experiences, and beliefs. So I'd also like to just point you to that little scale on the slide there. So we've got a 0 to 10 scale, with 0 to about 4 being a safe and acceptable sort of pain limit to be sort of guiding yourself when exercising. Alrighty, so in terms of barriers to exercise, so we have to try to find and make the time in your everyday life for exercise without interfering with your everyday plans. Seeing the purpose and knowing the importance of exercise and or weight loss can be motivating. So definitely write down your goals if you can. And in GLAD, we measure how long it takes you to walk 40 meters and how many times you can stand from sitting in 30 seconds, like I mentioned before. But I'd also like you to find other ways to check your improvement. So an example of this would be the time it takes you to walk around the house or up the stairs, and be prepared for times when you see minimal or no improvement. This happens to everyone, even high-level athletes, and it's good to plan a strategy on how to handle it if it happens. It's important to have support and access to someone who can help make adjustments to your exercise program or someone to answer your osteoarthritis questions. It's also important to have knowledge on how to start exercise and deal with osteoarthritis. How you want to structure physical activity and exercise is completely individual. And I want you to remember the best exercise is the exercise that gets done. Alrighty, so always remember, it takes a lot to damage your joints and muscles. Being active doesn't just help osteoarthritis, it helps prevent more than 35 other chronic diseases, including depression, cardiovascular and heart disease, diabetes, and falling. Getting more active will help. So doing something you like can be a strategy to divert your attention away from the pain. So I want you to try and remember a time when you forgot about the pain because you were preoccupied with an activity. Using activities in this way can be a great strategy to cope with pain. So try to have a healthy relationship with your pain. Even create a plan of how you will stay active. Okay. All right, so as you can see on the slide, there are 3 different coping strategies. So some people stop the activity, some people continue as before, and some people can do things differently. And you need to think very carefully before you give up an activity, especially if it helps you keep up your physical fitness or feels meaningful to you, or provides social stimulation and a sense of belonging. Research shows that those who stop doing activities have an increased risk of getting sad and depressed. Alrighty, so here are some strategies to stay active. Okay, so using supportive devices can help. Taking breaks more often. Divide the activity into smaller parts, which is a really nice strategy as well. Find other ways of working. Lower your demands and get help and support from others. And some self-management tips as well. So we'll just run through them. So stay active, aim for daily exercise, and find the things you enjoy. Don't sit for too long, so try not to sit for more than 20-minute periods. And reward yourself when you achieve your goals. Take charge of your own disease. Listen to your body. Use relaxation techniques. Monitor your range of motion. Get strong, stay strong, especially with your thigh, hip, and trunk muscles. Strive for optimal body weight and avoid limping, and aim for good control with exercise. Alrighty, so just a bit of a summary. So hang in there, it pays off in the long run. GLAD is based off the best available treatments for OA, and everyone is different, so you know what is best for you. Develop your own plans and goals, okay? So talk to your physios, like Tom and I, to help. And referral to other health professionals, such as dietitians, may also help, especially with the weight management. And just finally, here are some additional resources. So you've got the GLAD page, which you can Google. And you've also got the Royal Australian College of General Practitioners guideline, which is a good read as well. You can find that on Google as well. Alrighty, so what I'll do now is I'll pass over to Tom and he'll go through the final few slides. Thanks for listening.
Thanks, thanks Cam, and thanks everyone. So just going to run through the last section of the talk, which is just about the implementation side of things. So what is included in the program? So it's a two-part education session, which we've kind of done tonight as the one section. Then from here, we do a 1 hour individual assessment. So this can be done online or in the clinic, incorporating those 2 tests and some questionnaires that Cam was talking about. And during that session, we get to know you, we set some goals, and we also go through the 10 exercises and work out your starting level. From there, it's 12 supervised exercise sessions over the 6 weeks, so 2 a week. These are done online at the moment with a maximum of 3 per class. And then at the end of the 6 weeks, you have the confidence to continue with that exercise program and knowing how to increase it as you go along. And so with that, the 3-month mark, we get you back in the clinic, we redo those tests, we reset some goals, and then we continue on with the exercises. And then at the 12 months, at the completion of the program, 12 months, GLAD themselves will send out some questionnaires and get you to redo them to help collate some data. So what does it look like? Here's a short video. So that there's a short little video of 3 of the exercises that is in the GLAD program. So what happens in each class? So we do a 10-minute warm-up. We tend to try and, just for ease online, we'll have a chat in the initial discussion about how we can do this at home. So some people might walk around the house for 10 minutes beforehand, others they've got access to an exercise bike, so we do that. And then we have 10 exercises in total, so 5 pairs. And these include core stability, postural orientation, so keeping the weight of the knee over the leg, muscle strength in the legs, and some functional training exercises such as the going up and down the stairs in the picture there, and sit to stands, and then a bit of a cool down of some stretches towards the end. How's it run? I just kind of alluded to this before. So a 1 hour initial assessment with the outcome measures being recorded, familiarisation and starting at a correct level. The 2 weekly appointments over the 6 weeks, so 12 in total, and that's done through Zoom, which we're using tonight. The 3-month review, again, can be done in clinic or online via Zoom, and then 12 months of review of the written outcome measures through GLAD Australia. What about the database? So the great thing about GLAD is, as every time everyone starts a GLAD program, they get the option to be included in ongoing research. So in the event page, Cam mentioned that GLAD as a whole in Denmark, Canada and Australia, it's about to hit 50,000 people that have successfully finished the program, so huge numbers. And that's 50,000 people that have had access to, allowed us to use their data in the database. So basically looking at their scores from when they started the program, at the end of the exercise classes, at the end of 3 months, and the end of 12 months. And like I said at the start, so it's a chance to be part of important future and ongoing research. It was born out of that bottom-up approach, so using data gained from every class to change laws, guidelines, and clinical practice, which is really, really awesome. The database is voluntary. We do encourage everyone to try and be involved, but you don't have to. It allows continual improvement and benchmarking against other clinics to make sure that we're doing as good a job delivering GLAD as any other clinic delivering GLAD in the country. And it helps everyone improve, ourselves, other patients, everyone. The program costs, so people will usually want to know this. The total cost for the program is $590, minus any private health rebates or Medicare care plan rebates. That's a huge breadth of questions that can come from that. So that's going to be basically, we can give you item codes and you can contact private health to see what they will rebate, because there's just so many different funds and different plans out there that we can't answer those questions individually. Includes a bonus GLAD starter pack, which we'd post out to you if we're doing it purely online, with some resistance band and some sliders to do the exercises. The total value of the whole course, it's probably actually more than the 803 there, because that's based on a group class. If we'll do this individually at the average cost of $80 a session, so that's $160 a week by 6 weeks, it'd be a hell of a lot more than $800 in value there. In the breakdown, it's not $590 up front, so you pay for the initial appointment, and then the 12 classes can be paid weekly, and then the follow-up test would be paid further on down the line. Why should you complete a GLAD program? So as Cam alluded to, finish the course with improved joint confidence, reduced pain, better quality of life, less painkillers, less sick days, less likely to feel the need for surgery. And even if you do progress towards surgery, you'll have a much better rehab afterwards from being stronger going into that program. Where to from here tonight? So you can head over to the website to book an initial assessment if you'd like. If you'd like any more information, we can do a quick question and answer in a second. Otherwise, feel free to email us or give us a call at the clinic. We've kind of mostly touched off on the exercise session complete. So following that initial, we can get ready to join into a class. Current timetable looks roughly like this. So a mixture of morning and evening classes. This can change, and by all means, if there's a time that you could only do and you're desperate to do, by all means send it through to us and we'll see how we go. But that's our rough current timetable. So keeping in mind, the program's done best when it's completed twice a week. So one earlier in the week and one later in the week, where possible. So that brings us to the end. Cam and I are both sitting here. Down the bottom of Zoom, there's actually a question and answer button. So by all means, feel free to jump into that Q&A section. There might be a few things in the chat box. I'll just check there. So a few people there have different issues that they've described. There's a Q&A question there, and by all means, Jackie, yeah, if you'd love to just send us an email, we can get you the different item codes for the items that you need for health funds. So it'd be great if you could just send us a quick email and then we can reply straight to that. We can get them out for you straight away. So if there's any other questions, no problems, Jackie. If anyone else has got any questions, feel free to type them in to the chat box. We'll hang around for another few minutes answering any questions that might come through. Depends how quick a typer some people are. So feel free to send us through any questions now. Otherwise, like we said, by all means, shoot us an email, jump on the website, and we'll get back to you in the next day or so. And then otherwise, feel free to head off. Thanks for joining us on Monday. Cam and I really enjoy helping people with hip and knee arthritis, most definitely. This is what we really enjoy doing. So we look forward to getting more and more GLAD programs on their way. And just, right now with telehealth being front and center, it's really allowing us to see more people from all over. So not people just in our local area who may have trouble accessing some of these programs in their area. So we'll keep going through. We've got a few questions popping through. So this question here, does hydration make a difference? Are you drinking the recommended daily amount of water? Does to a degree. So hydration is always a very difficult study to do because there's so many factors in terms of how our body uses it and gets rid of it. But being chronically dehydrated is not a good thing. So the more fluid that we have in the body and the more optimal the body is in terms of its hydration level, the easier it is for fluid to move around the body, including in and out of cartilage. So I would say, yes, hydration does make a difference. Keeping in mind you can overhydrate as well. Question from Sue. Husband has rheumatoid arthritis flaring up at the moment. Will a program like this benefit him? Rheumatoid is slightly different. It's still an exercise and strengthening program still would benefit. In terms of the GLAD program, could still do the GLAD program, wouldn't qualify to join the database, which is fine. You'd still get the same great outcomes of doing the program anyway. It's a slightly different condition, but it still responds favourably to progressive load and exercise and a strengthening program. Question here from Kim. Seen Fiona, but haven't seen her since she went away. Knees are swollen and clicking. Feel I need to make a follow-up and make a new appointment for you guys. Haven't been diagnosed with anything as yet. Cam, do you want to talk about the arthritis diagnostic things just briefly?
Yeah, so in terms of diagnosing OA, so swelling to some extent can indicate some inflammation going on in the joint. Clicking potentially. Clicking can be there and cause you no pain, so that can be just a normal finding, so that's okay. Basically, in terms of knee osteoarthritis, some common symptoms are sort of trouble going up and down stairs. When you're bending your knees, you can get a bit sore. Some pain at the end of the night, at night time, so basically after you've been on your feet all day. And in the morning, you can get stiffness and a bit of discomfort. So there's some common sort of symptoms of OA. But I guess, a thorough assessment with some hands-on stuff as well, and just looking through different movements would be good to do as well, just to screen for any other things that could be going on.
Yeah, arthritis, one of the main diagnostic factors that's discussed a lot now is this morning stiffness. So morning stiffness lasting around half an hour, as well as fitting a couple of other brackets. So if there is morning stiffness lasting less than half an hour, then quite often it is osteoarthritis related, but it still needs usually a bit of an assessment, which can be done in clinic or online, just to make sure that there's nothing else untoward going on as well. Helen, we'll definitely put you on a bit of a wait list and get in contact with you as soon as we are allowed to do group classes in the practice again. So we can definitely do that. That's fine. Mary, kneecap tracking pain issues. Would this course benefit that issue? Yes. So definitely. So this course will help again. So the neuromuscular, functional neuromuscular exercises is all about that kind of alignment, tracking, and getting stronger into those positions that are painful. So definitely this kind of program would definitely fit in with that. Yeah, definitely. Jane, already doing 2 classes a week with Kelly. Jane's a bit of a fan of ours, aren't you, Jane? We love you. You're finding them terrific. That's great. I'll give Kelly a plug later on. Can the GLAD program be started later after I feel better? Particularly interested in the weight training. Yes. So this GLAD program, while it's already started, as we saw in the video with a few people earlier, it'll be ongoing. So there's ongoing intakes throughout the year. So there's no, you can continue with the classes with Kelly at the moment, and then later on down the track, whether we do it online or in clinic, more than happy for you to jump into a GLAD session to get a bit more of that strength back as well. Yeah. And that's the bottom of the questions at the moment. Once again, thanks for jumping on. We'll hang around for another 30 seconds or so in case another question pops in. But by all means, feel free to head off. If you're hanging around to see if any other questions come through like us, well then, g'day. Thanks for hanging out with us on a Monday. Yeah, so any other questions, knee, hip, osteoarthritis related, quickly pop them in that chat box and we'll answer them for you. Otherwise, we're going to sign off in another minute. Just with the online classes at the moment, they're done through Zoom, so the same platform that we do now. That allows us to see what you're doing. So part of the big component of GLAD is making sure that the exercises are done in a specific way. So getting alignment right as best we can. So we do, like in a class, how you'd be able to see other people in the class. You would be able to see other people doing the class online. And you can communicate to each other and you can make GLAD buddies along the way if you stick in the same kind of course time frame as someone else, which is always nice. And it's always great to share stories and work out what's been working for someone. Someone might be having an issue and they might be a bit more confident bringing it up, and you might have the same issue but haven't wanted to bring it up. And so it's a really good way to answer those questions.
Yeah, and also with that, when setting up sort of your phone or your laptop and doing it, setting up so it's got a full view of sort of your room, how you're doing it, so that we can see everything you're doing, and we can also like make comments on if you're doing anything sort of wrong or could be improved. So just finding a nice spot to either sort of hold your phone up or your laptop so that we can see basically the whole of you and you whilst doing exercises, either on the floor or standing or next to a chair.
James just popped in. Time for a wine. We probably agree with that, James. So we're gonna sign off now. By all means, send us an email if you've come across the event on Facebook. By all means, feel free to message us through Facebook as well. Any questions that pop in over the next day or two. If you want to get started, same thing. Send us an email and we'll get back to you. I'm pretty sure there's going to be a little survey come out at the end of this. It should only take about a minute or two to fill in, and if you feel free to do that, it'd be great just to get a bit of feedback on this event so we can do more of these and really give our followers what they want in terms of information packages like this and programs. So we're going to sign off now and say thanks to everyone.
Yeah, awesome. Thanks, guys. Thanks for listening. Hope to catch up soon. Good night.
Oh, just found a...
Couple more questions.
Couple more questions in the chat box that we found. So from Fiona, what happens after the GLAD program? So the idea of the program and doing the 6 weeks and the 12 sessions is to really educate you and give you the knowledge of how to take that program going forward. So going back into the community, exercising in the community, and continuing some of the exercises that would be in the program. Monica, there's a couple of big questions there. Fair bit to unpack with just that limited amount of knowledge. We are open for in-person appointments. And if you wanted to have a chat with someone, we could probably arrange that in the next day or two. If you want to give us a call and just say that you were on the webinar and the guy said we'd be happy to have a chat with you. And then a couple of people saying thanks, which is always great. So now we're definitely out of here. Okay, thanks Monica. That's a great idea. Give us a call and we'll one of us will have a chat to you tomorrow. So thank you everyone. Going to end this now. Have a great night and we'll catch you sometime soon. Cheers.
Cheers guys.